My name is Bita Ghatan, and I've been working in the field of mental and behavioral health for over 26 years. I'm a licensed and board-certified behavior analyst, and throughout my career, I've worked with thousands of families from all parts of the world in the moments of deep need. What broke my heart most was having to turn away families, not because they didn't deserve help, but because they first needed a diagnosis. And the reality is, a proper diagnosis takes time. Clinicians only have so many hours in a day, and these evaluations can take months to complete. I understood why the system worked that way, but it never made the pain of watching families wait for months or even a year any easier. By the time many came back, they had already lost so much valuable time. That's why I created Mindologi with a team of clinicians and professionals. Together, we built this platform to bring accuracy, speed, and affordability into the process, so families don't have to wait endlessly, and so clinicians can serve more patients in a shorter period of time without compromising quality. Through Mindologi, individuals can better understand their potential diagnoses, whether that's ADHD, OCD, anxiety, depression, dyslexia, and be guided towards the most appropriate treatment pathway. And for institutions, it means expanding access to care in ways that are both sustainable and impactful. Our vision is to create the expertise we've built over decades in this field and prepare it with innovation so that every parent, clinician, and institution has a trusted, compassionate resource they can rely on. So welcome to Mindologi. I know this platform will give you the clarity, support, and trust you need while transforming the way we approach mental health and treatment together.